Welcome to Eye Contact. I'm Roberto Bellucci, and today I'm joined by Simonetta Morselli, who will talk to us about news for the glaucoma cataract patient. Welcome, Dr. Morselli. You run a glaucoma center in Italy. At what stage glaucoma can be diagnosed reliably, and are there any methods to diagnose it earlier?
Yes. When intraocular pressure is slightly not normal or moved, I start to perform some exam to my patients. And the first exam is pachymetry. The second one is contrast sensitivity and visual field and optic nerve exam by OCT or other exam that we have in our clinic.
And why is ocular surface toxicity concerned during glaucoma treatment, and how can we improve on that to minimize problems?
When the glaucoma is clear and start, and when we diagnose that the patient is affected by glaucoma normally, the first thing we start with topical therapy and we prescribe drops for these patients. The first choice drops normally is prostaglandin, but prostaglandin have a lot of side effect on ocular surface in a long-term therapy.
There are pro-inflammatory drugs.
Yes, there are pro-inflammatory drugs. That's the reason why the patients sometimes discontinue therapy or needs other new drugs or other way to deliver the drugs into the eyes. Prostaglandin and the fixed combination with timolol are the most powerful drugs to control intraocular pressure and to achieve the target pressure of the patient, because every patient needs his or her target pressure to control the glaucoma stage. That's the reason why we need maybe new drugs, new principal drugs, or new type of delivery of drugs. That's the reason why in the United States, there is under approval natarsolid that is a prostaglandin precursor, and another new drugs is ROCK inhibitors drugs.
So these are new developments in medical therapy for glaucoma. Please explain them further, and do you believe they can improve patient compliance?
Yes, they can improve patient compliance because the fixed combination needs only once a day delivered into the eye. The prescription is only once a day, and also fixed combination is a very potent drug to decrease intraocular pressure. Also, these new drugs increase the aqueous flow, increase the blood flow into the optical nerve, and then decrease the epivenal pressure into the eyes. These three mechanisms help to control the intraocular pressure with a little bit different mechanism of the standard drugs that normally we are using. The side effects are a little bit lower than prostaglandin. That is the reason why this should improve the compliance of the patient using this type of drugs.
You are also a well-known cataract surgeon. So we heard in the past about intraocular lenses that might be soaked into drugs or might help us in deliver slow release of drugs intraocularly. Any news about that?
Yes, there are a lot of news about this. There are in this field, the research is very active. Then there are some contact lenses that are studied, soaked into the drugs that could deliver the drugs during the day, like a contact lens, normal contact lens. There are some conjunctival insert that could be inserted into the conjunctiva. there are some little piece of plastic soaked into the drugs that could be injected into the anterior chamber, and the delivery of the drug is for about 6 months. Then this type of plastic should be replaced into the ocular. Then I think that news are enough for the glaucoma
several
patients.
things, however, not yet available in clinical practice.
No, they are under study.
In your opinion, what will be just the next new way or new drug available in the market?
ROCK inhibitors, and the combination of the ROCK inhibitors and timolol and or prostaglandin. They are the new products that's under FDA evaluation and FDA approval. Not yet in Europe.
Thank you, Dr. Morselli, for being with us today. Thank you for being with Eye Contact, and please go on following the ECRS activities in the web. Thank you.